Welcome to the latest episode of Digital Bitesize Training. This is a programme for Greater Manchester Primary Care Provider Board aiming to support Greater Manchester general practice in making best use of digital tools. Today we're going to be talking about ambient voice technology. My name is Dr. Chris Nortcliff. I'm a GP in Manchester and I am the Chief Clinical Information Officer for Greater Manchester Primary Care Provider Board. So, what is AVT? So AVT is Ambient Voice Technology, also referred to as ambient scribes and various other synonyms. And what it does is it uses artificial intelligence to listen to conversations between clinicians and patients in real time and turn them into a structured clinical note. It works in the background. Obviously, this is where the ambient in the name comes from. And it means that there's no need to type or dictate during the consultation. It captures relevant information automatically. The AI can then identify key details such as the symptoms, the history you've taken, medications you intend to prescribe, and your management plan. And it then generates a draft consultation note for review. The aim of this technology is to reduce the admin burden, improve the clinician-patient interactions, and free up time for care. I know for a long time the burden of writing notes has been borne by clinicians in general practice and in healthcare generally. The intention with ambient voice technology is to free clinicians from that burden, so you're not needing to spend time writing notes after a consultation. You can be sure that it's accurate and thorough. So how does it work? So the speech recognition technology converts the spoken conversation into text in real time. Natural language processing, or NLP, is technology that analyzes the conversation to understand meaning, context, and clinical relevance. The AI works by filtering out small talk and bits it deems to be irrelevant on the clinical conversation and focuses on the key clinical information such as the symptoms, history, examination findings, the plan. It can then structure the information into a clinical note as directed by a prompt embedded in the software. So when someone uses AI technology, people use Copilot, ChatGPT, Claude, these technologies require you to construct a prompt to tell the AI what to do. That's the same in this technology. However, the prompt is predetermined and already written in the background, so it already knows that the purpose of its role as the AI is to listen to the conversation, pick up on key details, and turn it into a appropriately structured clinical note ready to go into the notes. Key thing to ask here is, what are your responsibilities as the clinician using ambient voice technology? Now, I hope people are aware of the term human in the loop, but this means that every output from the AI needs to be checked every time. You as the individual clinician are responsible for what gets entered into the notes. It's not defensible to be able to say, oh, that was the AI's mistake. You are responsible. So if you're using AVT, check every note. You need to get consent. So patients need to be aware that AI is being used to record the consultation, and be aware that the AI is going to formulate the notes. Now, this can be framed in a really positive way, that actually it's an opportunity for the clinician to not be writing any notes during the consultation, to have their whole attention focused on the patient. And it's also a good point to explain that you as an individual, as a practice, have ensured that the technology that you're using is safe. It's important that you remember that the AVT is there to do transcription and summarization only. It's not to be used for decision making. This requires a different type of compliance as a different type of medical device, and at present this technology is purely for recording the notes, not for making decisions for you. It's really important to remember that. So how can you get the most out of ambient voice technology? So obviously it's important to speak really clearly and to have an appropriate environment. So that includes having an appropriate microphone that's going to be able to pick up the conversation of you, hear your voice and the patient's voice. It'll also need to pick up information and your voice as you might move around the consultation room, such as when you move to perform an examination. You should think about which consultations may benefit most from ambient voice technology. So it's not necessary every consultation, and I'd really recommend that anyone using these tools really think about where it might bring benefit and where it might not. For example, some consultations are really very brief and may not need you to use AI to record the details. It's probably not worth using in those circumstances. Equally, there can be some really complex consultations, and some consultations will go on a lot longer. You might want to consider how much of the AI's recording you use in your clinical notes. Sometimes too much information can be create a lot of noise in the record and might not be helpful in the long run. So have a think about when's the best time to use it. So it's important, as I mentioned previously, that you describe what you're doing and what your examination findings are. This might be a change in consultation style for some clinicians. Examining someone and explaining exactly what's going on, what you're doing and what you're finding is really important in order for the technology to be able to create an appropriate and accurate clinical note. Remember, it's not watching what you're doing, it's listening to the voices in the room. So this can sometimes be a downside for using the technology, as some clinicians might find it uncomfortable changing their way of working that they've done for a long time. But at the same time, there is I've heard some anecdotal feedback that patients really like this, that they are getting a running commentary of exactly what's going through your head as a clinician, and can be quite informative during a consultation. It's important to audit and reflect on your use of ambient voice technology. So going back and checking that your notes are good quality, that you haven't missed any errors, that you're finding benefits of using it. It's really interesting to go and reflect on how it's changed your practice. Have you seen it? For example, if you use the technology for a month, it'd be really interesting to reflect back on, have you found yourself less stressed? Have you felt you get to the end of the clinical day and feel less burnt out? Do you remember what's happened in previous consultations, or has that reflective process been taken away? So think about whether you're getting the intended benefits, or if there are any other benefits or downsides that you weren't expecting that have occurred. So I've just mentioned some of the downsides of ambient voice technology, but it's important that we go through this today. So there can be errors. AI is not flawless, and it can hallucinate, or it might pick up erroneous information. It might mishear what you said. So this is why you need to be really careful about vigorous checking of the notes every single time. I think it can probably be quite easy to fall out of the habit of doing this if you're used to the AI being really accurate, but even 1 out of 100 notes that's wrong can be harmful and have serious consequences to the integrity of the medical record. Be careful when consulting with patients who might have strong accents or if interpreters are in use. These ambient voice technologies can cope with accents and interpreters, but it may not be quite as helpful as it is without these circumstances. And again, it just reiterates the importance of checking what's written and making sure that the note is accurate and a true representation of the consultation that you've had. This one I think about a lot. Writing a clinical note is not just a record of what's happened. It is a cognitive process of reflecting on the conversation you've just had with a patient, thinking about how you've come to decisions and thinking about what you as a clinician are going to do about that. I often reflect that in my career as a GP, I've frequently finished a consultation, written my notes, and then thought differently about the patient I've just seen and need to pick up the phone and find out some more information, sometimes change the plan completely. Be wary that using ambient voice technology can sometimes take that reflective period away. That's not to say that you can't reflect if you're using ambient voice technology, but it's not built into the structure that you'd normally follow in terms of writing a note. So if you are using ambient voice technology, think about how you're going to reflect on each case you consult with, and potentially factor that into your new consultation style. Trainees is an interesting one. Now, trainees are potentially some of the people to benefit most from the time-saving elements of ambient voice technology. However, in order to appraise the AI's notes, I think it's really important that people have developed effective record-keeping skills, knowing what's important to include and what's not relevant, understanding how the tone of your note, particularly in the environment we work in where patients have access to their medical records on the NHS app, making sure that the note you've written is going to be received in the way it's intended. And I think that it's important that trainees continue to develop effective record keeping skills as part of their training, rather than solely rely on AI to do that for them. So, can you just start using it now? For any digital technology we implement in the NHS, it's really important that clinical safety assessments are carried out. So if you're using a ambient voice technology, then you must, or your practice, the organisation you work for, must have completed a DCB 0160 clinical safety standard assessment. Equally, a DPIA, a data privacy impact assessment, is really important. So you and the practice and the patient need to be assured that any data flowing through that technology is being managed safely and that there are no risks to their data privacy. I also think that having a standard operating procedure is crucial. This ensures that practice can be assured that all of the necessary safety protocols are in place, such as checking every note as it's put in, making sure that we're watching out for hallucinations, making sure that if you work in a practice and trainees aren't supposed to be using this under your governance, that's documented in a standard operating procedure. I think it's crucial for making sure that these tools are used in a clinically safe and appropriate way. And be careful of free trial offers. So these are great. It's great to be able to try using technology before a practice decides to invest in it. Sometimes they can be quite costly. But be aware that the clinical safety assessment, the DPIA, and really a standard operating procedure should be in place even when using a free trial. Do be aware that just clicking on accepting a free trial doesn't just give you a short period of free. Well, it does give you a short period of free use. However, there will be a cost coming at some point, so just be very wary of that. So for my final thoughts on this, AVT can be a great tool to enhance productivity in primary care, and we're already seeing lots of clinicians get great benefits from it, but it needs to be used carefully. Make sure that you're completing all the necessary compliance checks, make sure that the governance is in place, and make sure that you feel comfortable with how you're going to be using this tool and how it might change your consultation style.